Hi everyone, I'm Dr. Claire Ashley. I'm a GP and I am the owner of Ethera Aesthetics based in Portishead, North Somerset. Today I'm going to be talking about one of my favourite subjects, which is medical grade skincare. What makes skincare medical grade? So medical grade skincare is skincare that has been developed to target medical problems. Medical grade skincare sometimes requires a prescription from a medical professional. Sometimes the products don't require a prescription, but you can't buy these products over the counter. You need to have a consultation with a specifically trained medical professional in order to access them. Is medical grade skincare better? So medical grade skincare has the advantage of having a higher percentage of active ingredients compared to high street and over-the-counter skincare. So if you're treating an issue such as acne, then you will probably get better results than using high street skincare products because you'll get a higher concentration of active ingredients. The other advantage is that because you're having a consultation with a specifically trained medical professional, they will know which products will suit your skin and your particular needs as well. The other advantage to using medical grade skincare is that quite often the way that the product is delivered in the skin is different to high street skincare products. So for instance, I work with pH Formula. pH Formula have developed a delivery complex that allows the skincare to penetrate down to the deepest layers of the skin and then work on the skin from the inside out. Quite a lot of high street skincare products sadly just sit on the top of the skin and they're not absorbed, and so they don't work in quite the same way. How long does it take medical grade skincare to work? I would say this is variable. What I normally advise my patients is that it takes 2 to 3 months for medical grade skincare to really start making a difference. And what we would normally do in clinic is to take a photo at the start of your treatment course, and then we can refer back to that to see what the changes have been. For some patients, they do get changes that occur almost instantly. So I have had some patients who within a matter of days, their skin has completely transformed. But equally, I also have some patients who have quite stubborn problems and problems that have been difficult to treat. And that takes much longer than 2 to 3 months to really get their skin to start to settle down. What is the best medical grade skincare brand? So there are lots of medical grade skincare brands available. Abaji and Illumina are probably the best known brands. I'm actually trained in Abaji, but the skincare brands that I use is pH Formula. I wouldn't say that any are particularly better. They're all relatively much for muchness. They're all really, really good. But the reason why I work with pH Formula is because they are a relatively small, family-owned and family-run brand. And as such, I get a really, really good level of service for myself, but also for my patients. Who can sell medical grade skincare? So for prescription only products, obviously you need a prescriber. So that would be a nurse prescriber, a doctor or a dentist that would be able to sell those products to you. Some of the products are not prescription only products, but the person that is selling them to you would still have had specialist training in order to sell you the correct products for your skin type. So anyone that sells these products has to have had specific training with the company that they work with. So what medical grade skincare is good for acne? So in acne, what you want to treat is the cause of the acne. So acne is caused by a bacteria that grows on the skin, typically tends to be kind of fueled by hormones. And what you want to do is to reduce oiliness, reduce the appearance of pores, and to reduce the activity of that bacteria on the skin in order to treat the acne. Now, the way that I normally do this with my patients with medical grade skincare is firstly to get the skin cleansed properly. You don't want a harsh cleanser. You want something that is gentle, that is going to cleanse effectively, but not strip the skin of its natural oils. Because what happens in acne is if you strip the skin of its natural oils, the skin then goes into overproduction of oil that then fuels the bacteria and makes your acne worse. And then of course you think, oh my God, my acne is worse, I need to cleanse more. And so the cycle continues. So you need to break that cycle and use a gentle cleanser. So the Expo Cleanse from pH Formula is fantastic for doing that. And then what your skin needs is some active ingredients designed to treat acne. So the sorts of ingredients that you might be looking at would be vitamin B, salicylic acid, and retinol in particular. Zinc is another really good ingredient for acne. What medical grade skincare is good for rosacea? So rosacea is a condition where you get very sensitive skin, very red skin, typically tends to be across the cheeks here, but sparing the eyes. Sometimes you get spots, and you also tend to get kind of very, very flushing as well. In rosacea, the aim of treatment is to restore the skin barrier, because once you start to rebuild that and improve its function, then the redness and the spots will get better. So the sorts of ingredients that you need to look for in your medical grade skincare are vitamin B. So vitamin B is really good for hydration. Also hyaluronic acid, also really great for moisture. Azelaic acid is a really fantastic ingredient for treating rosacea as well. You need a very gentle cleanser, no harsh chemicals, no alcohol at all, because you don't want that, you don't want your skin barrier to be disrupted any more than it already is. And then products such as oils and shea butter is also really helpful for rosacea. So a combination of those ingredients will help to restore the skin barrier and improve the appearance of the skin. What medical grade skincare is good for hyperpigmentation? So for my patients with hyperpigmentation, it's really important to work out how deep the pigmentation is, because to be quite honest, if the pigmentation is really deep in the skin, doesn't matter what medical grade skincare you use, that pigmentation is just not going to get any better. So for those patients, I would advise that they look at other treatment modalities such as laser to help lift the pigmentation. However, if the pigmentation is more superficial, then medical grade skincare will help, particularly in combination with in-clinic treatments such as chemical peels and skin resurfacing. Will medical grade skincare help with hormonal acne? So with hormonal acne, what women complain of is that typically around the time of their period, their acne gets worse and they have breakouts. Medical grade skincare can definitely help with this, and what I find with the patients that I treat for hormonal breakouts is that over time, the breakouts, so let's assume these are the breakouts, right? So you've got hormones, bad acne, hormones settle down, good skin. What you'll find is that with time, the peaks and the troughs will kind of level out. And so what I find with my patients with hormonal acne is that sometimes we can't, I'm being completely honest here, sometimes we can't get rid of the breakouts completely if we're just using medical grade skincare. So you might have maybe a couple of spots at the time of the month, but the breakouts will have nowhere near the severity that you used to have. It's also important to think about treating hormonal acne with potentially the combined pill. So this is the GP and me talking. Now I know that for some patients it's they're not able to go onto the pill because of medical reasons, and I also know that some people don't like being on hormonal treatments for acne, but I would always discuss that with my patients as a potential treatment for them as well. Next question is, what is my can't live without product? So for me, it has to be the pH Formula Vita A cream. This cream is phenomenal. So I have PCOS, I'm also of a certain age, and I'm starting to notice the development of fine lines and wrinkles. Retinol is an amazing product for treating both spots and the development of fine lines and wrinkles. Now, I personally have tried all of the retinol products. So I started with high street skincare. I then progressed to prescription only skincare. So I got my retinol prescribed for me for a period of time. And then when I started in aesthetics, I then started using this cream. Now, I'm not just saying this because I work with pH Formula, but this product has been the best retinol product that I've tried ever. And now you will have to prize it. I'm never giving it up. You're gonna have to prize it from my cold dead hands before I ever give it up.